আমি প্রভাস রায়, পশ্চিমবাংলার নদিয়া জেলার অন্তর্গত করিমপুর থেকে আজকে মণিপাল হোয়াইটফিল্ডে এসেছি আমার চিকিৎসা করার জন্য।
Hi, I am Dr. Pradeep Haranahalli, consultant cardiologist working with Manipal Hospital Whitefield. I am here to talk about one of our patients we treated recently. Mr. Prabas Roy is a 70-year-old gentleman. He lives in West Bengal. He had undergone permanent pacemaker implantation for complete heart block, fainting episodes in 2014. He had been doing fine all through, but by the time it was 2019, he started noticing that his pacemaker lead were started visible externally, and slowly the pacemaker device also became appearing externally. The pandemic of COVID also came on the way of him taking timely advice and timely effective curative treatment. So infection in pacemaker is one of important and a concerning complication. We see infection in the pacemaker to the tune of about 1% of our patients. Even though we take utmost precautions during the pacemaker implantation, yet a small portion of patients are still prone to pacemaker infection. Any foreign body inserted into human body is or can be a nidus for catching infection. However, most commonly the infection is found in the immediate few months of pacemaker implantation. However, in case of Mr. Prabas Roy, to his bad luck, it started haunting him many years later.
গত 1913 সালে আমার পেসমেকার লাগানো হয় কলকাতায়, কিন্তু পেসমেকারটির না থাকার জন্য 8 বছর চলার পর হঠাৎ পেসমেকারটি থেকে একটা ইনফেকশন দেখা দেয় এবং সেই ইনফেকশনটাকে আবার পুনরায় যখন আমি কলকাতার আরএন হসপিটালে যাই, পেসমেকারটার যে ইনফেকশনটা হয়েছিল সেটা দেখানোর পরে,
but to his fortunate luck he hadn't met with a life-threatening problem which was expected in the due course of time if it was not taken care timely. After he met us, we started planning for the complete treatment. We evaluated him thoroughly and had a strategy in plan in order to achieve a complete curative treatment. The treatment, as I discussed, would include a complete explantation or removal of the whole permanent pacemaker device which was already there in the body, as well as the lead which were implanted in the body, and redoing it all over again. It would be a tedious process and would involve a prolonged hospital stay for the very reason that he was completely dependent on the pacemaker, or his heartbeats were completely dependent. He did not have any internal rhythm. So this was adding to our worry, because for even a single second he cannot survive without having a pacemaker backup. So in order to meet the ends possible, we had to plan meticulously, choose each and every step in a systematic manner so that at no point in time he is free of pacemaker support.
ডাক্তারবাবুরা এটা বলেছিল যে এটা পেসমেকারটা একটু নড়ে গেছে বা সরে গেছে, যার ফলে আপনার এটা ইনফেকশন। তারপরে পেসমেকারটাকে ঠিক করে দেওয়ার জন্য ওনারা একটা চাপ দেয় এবং সেই চাপের ফলে আমার পেসমেকারের একটা তার ব্যাকা হয়ে যায়। আমি পরবর্তীকালে করোনা হওয়ার জন্য আমি ওইখানেই বাড়িতেই থাকি আর কি, এবং ইনফেকশনটাকে অ্যান্টিবায়োটিক বা ইঞ্জেকশন দিয়েও ঠিক মতন হয় না। প্রায় 2 বছর পর আমি আবার মণিপাল হসপিটালে আসি, এসে দেখাই এবং ডাক্তার প্রদীপ হরনাল মশাই আর কি, উনি ডাক্তারবাবু বলেন যে এখানে ভর্তি হতে হবে এবং এই ইনফেকশনটাকে দূর করতে হবে। প্রথমে ওই পেসমেকারটাকে বের করে নিয়ে তারপরে আপনার ইনফেকশন দূর হলে তারপরে আবার আপনাকে নতুন পেসমেকার লাগাতে হবে।
So we evaluated by doing a venogram that told us that the whole of subclavian vein was completely thrombosed and there was hardly any flow left in the left subclavian vein around the pacemaker leads. So this was adding to one of our concern and also was giving us an indication that lead extraction process could be difficult one. And then when we examined the pacemaker pocket area under fluoroscopy, we could see that the pacemaker had eroded the whole of chest wall area and had gone migrated downward and started appearing the puckering of skin in the breast area, and it was about to burst open near the breast lower down. So with this in concern, we hospitalized him and then started him on the empiric antibiotic coverage to reduce bacteremia, and the blood cultures had already shown organisms, which was one of our concerns because any such procedure cannot be done when the person has active infection. The plan here was to have a temporary pacemaker backup which would work in a foolproof manner, because temporary pacemakers are prone to movement and dislodgement, which can be a concern since our patient was completely dependent on pacemaker. So we first implanted a temporary pacemaker. This was a specific one. We used a permanent pacemaker wire and we gone through the jugular route, and externally we kept a permanent pacemaker, one of older permanent pacemakers, as a lightweight option so that he can continue to maintain on this for a prolonged duration of his hospital stay. We used an active fixation lead so that his chances of displacement is lesser, so that we will not have emergency situations while we are waiting for the infection to be cleared. This is a complex process because it can involve life-threatening complications like myocardial rupture and also IVC, inferior vena cava, or superior vena cava perforation. So in such situations, patients can bleed profusely and it can be instantaneously lethal, or sometimes they would require emergency surgery to bail them out. In our case, we could successfully extract the right ventricular lead. However, right atrial lead posed a lot of challenges. He was through the process of clearance of infection. Fortunately, over about 15 days, we were ready to proceed further with the next step, that is implanting a permanent pacemaker on the opposite side. This procedure was more of a routine scenario, the way any pacemaker implantation is done. However, the only concern is recent surgery for removal of the remnant of right atrial lead and a scar over the right atrium. However, this did not pose a serious challenge to us. We could manage to implant the permanent pacemaker on right side, and now it's been 3 months post procedure. He is totally free from any signs of infection and he is leading a active healthy life.
এখন আমি মোটামুটি প্রায় 3 মাস অতিক্রান্ত হলো, এখন আমি সুস্থ এবং আমি আবার চেকআপে এসেছিলাম। উনি দেখে সমস্ত পরীক্ষা নিরীক্ষার পর দেখে বললেন যে হ্যাঁ সব ঠিক আছে, আমি সুস্থ এবং স্বাভাবিকভাবে স্বাভাবিক জীবনে আবার জীবনযাপন করতে পারব। যার জন্য আমি ডাক্তার প্রদীপ স্যারকে আমি অসংখ্য আমার ধন্যবাদ। আর মণিপাল হসপিটালের যে মানে সেবা শুশ্রূষা এবং অন্যান্য দিক থেকে যে সমস্ত আমাকে দেখভাল করেছে তার জন্য আমার অসংখ্য ধন্যবাদ জানাচ্ছি।